I'm going to perform the skill Denture Care for a dependent resident. Okay, we do not, for this skill, do their mouth care, but for real world, you want to make sure that you're going to also clean the inside of someone's mouth once the dentures are out, as well as their dentures. But for state, you're just going to be cleaning their dentures. Okay? So here we go. Hello, Brett. My name's Kathy. I'm your nurse aide today, and I'm here to do your denture care. Okay? So, is it okay if I get into your bedside stand to get your dentures out? Okay. So before I get started, I'm going to use the hand sanitizer, which is right here on the bedside stand. I'll rub my hands together until the hands are dry. Okay, I'm just going to move this up so you can see. Okay. And then I'm going to go ahead and open the bedside stand, and in here I will find his denture in the cup, and his toothpaste, and his denture brush in here. I'm going to go ahead and leave this open so that I can put them back without any problems. Then I'm going to come over here. I'm going to go ahead and get myself a pair of gloves. And I'm going to need a washcloth. I will then need to go to the sink to get a barrier for my counter, which is where I'm going to put my equipment. Set that there. And I'm going to go ahead and I'm going to go ahead and put my washcloth in the bottom of my sink. I'm not going to touch anything down there except for my clean washcloth. Okay, and then I'll take my paper towel and turn on cool water. Okay, you don't use hot water, but this is gonna, you don't turn it on real fast, but you don't turn it on real slow. You just kind of, nice steady stream. The washcloth will pad the bottom of the sink, and then that'll create like a little cushion down there just in case we drop the dentures. Okay, and then I'm going to go ahead and put my clean gloves on. Okay. Okay, so once we've got the gloves on, we're going to go ahead. When you go to state, they typically just have you clean either the top plate or the bottom plate of the dentures. I have the top plate. I'm going to set that on the lid of my denture cup. I'm going to go ahead and rinse out my denture cup and fill it with cool water and put it over here on my barrier. I'm going to go ahead and wet my toothbrush and put toothpaste on it. And get that ready. Okay. And then I'll get my dentures. And I need to hold my dentures over the sink in case I would happen to drop them. I wouldn't want to drop them over anything else because I don't want to crack them. They're expensive. Okay. I always like to say my Aunt Mildred doesn't need them anymore, but I'm just kidding. It's my Uncle Ed. You need to make sure that you brush not only the teeth, every surface of the teeth, front, back, and chewing surface of the teeth, but you also need to scrub the palate. Okay. And that's what this part of the toothbrush is for. You need to kind of get some toothpaste in there. Okay. Then you get in these little crevices here and get all the stuff out. If there's any food left in there. They also have a tendency to wear denture cream, and you can get that all. Okay. And the thing is, you want to also check to see if there's any loose or cracked teeth, and make sure the dentures are in good shape for people, because we don't want them to hurt themselves. Okay, so you go ahead and put that in the denture cup. You need to put your equipment away nice and clean and dry. So you're going to dry your toothbrush, okay, and just give it a good squeeze. Okay, make sure it's nice and dry. Put it back in your emesis basin here. I'm going to rinse off my lid. Okay. Put it back on the denture cup. Nice and tight. Okay. And turn the water off there. Okay. Okay. Then I'm going to go ahead and pick up my dentures and my emesis basin. I'm going to go ahead and I'm going to put it back into my bedside stand. Okay. And then I can do a little hip action here. Well, it was a little hip. Those are stuck and we have to put some soap on them. Anyways, you go ahead and you put that in, and then you go ahead and get your washcloth out of the sink. While you still have your gloves on, because you don't want to do it without your gloves. And then you go ahead and put it in your hamper. Okay? Then you're going to go ahead and take your gloves off. Glove to glove, skin to skin. Okay? That's good. And then I'm going to go ahead over here. He has this call light within easy reach. I can go ahead and hit my hands with hand sanitizer. This is a skill that you don't need to push, pull the curtain, since we're in the restroom doing his teeth. Fred, if you need anything else, you let me know. Your call light's right there next to you. Okay? Thank you. And then you can exit the room.